Well, as far as the actual physical calculations are concerned, there is no difference. We would calculate heart rate ranges based on the same information, walking paces based on the same type of information. Where the exercise prescription would differ would be with type 1 diabetics. With their insulin use, they are at a slightly higher risk for developing hypoglycemia or low blood sugars during exercise. And so we would need to educate them on ways to prevent hypoglycemia with exercise and associated around post-exercise as well. With diabetic patients, we'll have them check their blood sugar immediately before exercise and then immediately after exercise, say within 15 minutes of stopping the exercise session. This gives them a really good idea of how they respond to exercise, and it's a real educational point for them to be able to know how they can adjust medication or insulin doses or even carbohydrate intake. So there is a safe zone for exercise for patients exercising with diabetes. Generally speaking, the low end, we want them to be at least 5.5 millimoles. The reason being, exercise is an effective way to reduce blood sugar levels. And if they're already at a low level like that, the exercise can further lower their blood sugars. On the high end, we look at a number of around 16.7. And at that point, what we need to check is whether or not they have forgotten any medications, whether or not they're feeling well, if they're suffering a current illness, looking for reasons to explain why their blood sugars may be high. That does not mean that they cannot exercise, but we just need to get to the reason as to why their blood sugar is high at that point. So after exercise, if a patient's blood sugar is low, what we will do is get them to ingest 15 grams of a rapid-acting carbohydrate, such as glucose tablets, 6 lifesavers, a half of a Tetra box of juice. And then we will get them to wait 15 minutes, check their blood sugar again. With that 15 grams of carbohydrate that they've taken in, it should raise their blood sugar by 2 points and therefore take them out of that low blood sugar range.